Hello, everyone. So today we're going to be talking about one of the adjuncts to the OT practice, which is kinesiology taping. Now, to give you an introduction, here's a brief background about kinesio taping. So its proponent is Dr. Kenzo Kase, a Japanese chiropractor and acupuncturist. So it was first developed in the 1970s, and the idea was to mimic the therapist's hand using elastic tape on the patient. So by theory, it is based on the neurophysiological mechanisms and the effect of mechanical stimuli on various systems of the body. We are talking about the different degrees of stretch that we're going to apply to the skin and how it will affect the different systems. So for the CNS, it activates afferent pathways to the CNS. For the skin, it changes the concentration of the tissue in the epidermis and the dermis. For the fascia, the direct tension loosens the fascia of movement limitations, and for lymphatic circulations, taping facilitates decompression and activates lymphatics. We have four major functions of kinesio taping. It supports muscle, removes congestion of body fluids, activates endogenous analgesic system, and corrects joint problems. So what exactly is kinesiology taping? So by definition, it is a tool utilized in rehabilitation to manage pain, soft tissue injuries, tissues and joints, malalignment, edema, and a lot more. And what is it made of? So it's either 100% cotton, including elastic fibers, along with a blend of polyester and cotton elastic fibers. Other properties of kinesio taping includes its ability to stretch up to 140% of its original length, recall back to the anchor. It was also heat activated, hypoallergenic, and latex free. Drying time after being what we be including 5 to 10 minutes, and it can be worn for several days. So how does kinesio taping exactly work? The adhesive on the tape microscopically lifts the skin that mobilizes the fascia, increasing the space between the tissues, therefore alleviating discomfort, facilitating drainage, and allowing for a decrease in inflammation.
So who can benefit from kinesiology taping? Those whose jobs requires strenuous physical effort and frequent movements, like construction workers, factory workers, gardeners, mechanics, miners, secretaries, and many others. Those who have sedentary lifestyles or those who spend most of their days sitting at a desk. Those with joint pains, athletes and other physical active people including cyclists, golfers, joggers, and other exercise enthusiasts or those involved in sports. Also, those people who suffer the after effects of bad posture, poor sleeping habits, and those people who suffer from joint, muscle, or tendon injuries of any kind, whether due to disease or accidents.
So these are our state-of-the-art journals. We included 3 journals of kinesio taping method and occupational therapy. The first journal is the effectiveness of kinesio taping in improving the functional activity of upper limb in hemiplegics. So this study resulted in significant improvements in the functional activity of the hemiplegia patients after KT method. The next journal is the effect of kinesio taping on motion, pain with functional performance, and subsequent quality of life in subject with subacromial impingement syndrome. The research study resulted in improvement in range of motion, functional performance, and quality of life among the subjects. The next journal is the effects of kinesio taping on body functions and activity in unilateral spastic cerebral palsy, a single-blind randomized controlled trial. So this study also resulted in improvement of short-term muscle power, functional muscle strength, and gross motor function, and independent activities of the daily life of children with unilateral C. So these are our references.
These are the parts of a kinesio tape: the anchor tab, the front side, and the back side. These are the types of bands: the I band, the Y band, and the fanning band. Let's talk about skin irritation. Skin irritation is caused if there's too much stress in the tape.
If the anchor ends are stretched, they pull on the skin during movement. This also causes irritation. Unshaved areas also become irritated. Direct contact between the skin and the tape is ideal. Irritation on shaved areas is also triggered because the skin is more sensitive after shaving. For skin preparation, there is no need to apply any topical agents beforehand. So for application, there is a technique when it comes to Kinesio taping. For overused or acutely damaged muscles, the tape is applied from insertion to origin of the muscle. You must apply this with no tension or no stretch. The opposite is the origin to insertion application. This is for chronic or acutely weak muscles. You will apply this with light stretch or tension. For injured joints or ligaments, medium to full stretch is used.
For the purpose of this report, we will be using the I-band as our example for demonstration, and we'll only be sticking the Kinesio tape on the paper. We will show you how to prepare the Kinesio tape for application. After you have cut out the desired length of tape, you will prepare your anchor tabs. Fold these tabs, making a clear line on the backing between the center and the anchors. Next, tear the lines you have folded in preparation for the application. And that is how you prepare the Kinesio tape for application. We are going to showcase to you just how stretchable the Kinesio tape can be. The tape, according to Kenzo Kase, has 120 to 140% stretchability. So take this into consideration when cutting your tape. Next, we will show you how to apply the KT using the end-to-end application technique. First, remove the backing from one anchor tab and apply this without stretching the tape. Then, remove the backing at the center area. You may now apply this with the desired amount of stretch. Lastly, apply the last anchor tab without stretching. After all this, you may rub the tape to induce heat, which can activate the tape. This is the center application technique. First, remove the backing of the center area. Then, apply it with the desired amount of stretch. As you can see, only the anchor tabs are left. Without stretching the anchors, remove the backing and apply them on each side. Lastly, for this video, we will demonstrate how easily removable the tape can be. So just gently grab one corner or side, then slowly peel away the tape. However, for application on real skin, it is better to remove the skin from the tape rather than the tape from the skin. You can also apply baby oil or soapy water for easy removal. And that is the end of our presentation. Thank you.